could watch. So we'll start off with just some general nutrition tips. And for those of you who don't know my voice, my name's Lisa. I'm one of the registered dietitians at Taussig Cancer Center, and I will be providing the nutrition information in this presentation today. So just some general nutrition tips. Good nutrition during cancer treatment can help you feel better, keep up your energy and strength, maintain your weight and your body's store of nutrients, better tolerate treatment-related side effects, lower your risk of infection, and heal and recover fast. Now, when you're healthy, eating enough food to get the nutrients and calories that you need is usually not a problem. But when you're being treated for cancer, these things can be hard to do, especially if you have side effects or just don't feel well. And good nutrition is especially important if you have cancer because both the illness and its treatments can change the way you eat. So, first, we're going to discuss calories. And you may need increased calories throughout your cancer treatment because of the increased metabolic activity. And your dietitian can help you calculate your specific individual needs based on your body weight. Now, it may be difficult to consume adequate calories while undergoing treatment due to nutrition impact symptoms such as decreased appetite, nausea, early satiety, constipation, etc. Now, adding more calories can help maintain or gain weight and prevent or halt unintentional weight loss. And that's our main goal is during the course of treatment, we want to prevent that further unintentional weight loss and we want to maintain what you got, which can be difficult, like I said, due to certain nutrition impact symptoms. These are some tips to add some extra calories. Now, when we don't feel like eating, the answer isn't, well, just eat more because physically and mentally, the thought of increasing your portion sizes or the sizes of your meals is just not possible. So we need to be creative on ways to sneak in extra calories where we can by using sauces, condiments, gravies, oils, or butter to your foods that you're already consuming. So, like sausage, such as barbecue sauce, ranch, honey mustard, adding mayo or ketchup to your sandwiches, adding olive oil to pasta, rice, or veggies. A tablespoon of olive oil is 120 calories. So, right there, you add that to some noodles before you add on your pasta sauce, and right there, you got some additional calories. Fat provides a lot of calories in a few bites. So that's why we mention like oil or butter or things of that nature. We also want to choose whole milk or full fat yogurt or full fat cottage cheese instead of skim milk, skim products, or like low fat products. Now, this is the total opposite of what you might typically hear if you were not going through cancer treatment. You know, we always want to look for lean fat, low fat products. But right now, if you need more calories, choosing those full fat products are going to give you the most calories, and that's what you want to do. We're not as concerned with what your cholesterol level is if you're trying to maintain your weight and prevent unintentional weight loss. Also, adding avocado to your sandwiches or wraps. Avocado is a healthy fat. It's going to contain a lot of calories. That's going to be beneficial. You can also use oral nutrition supplements. So when we hear oral nutrition supplements, these are like Booster Ensure supplements, Carnation Instant Breakfast, Fairlife Nutrition supplements, or Premier Protein. Now, the Fairlife Nutrition Plan and Premier Protein do have a little less than 200 calories. They're more like 150, 160, but they are still going to provide you with a significant amount of calories if you consume more than one a day. These are some high calorie snack ideas that go through 100 to 300, 300 to 500, and 500 to 800. So when we think of higher calories, Some of the things are what I previously mentioned, like the avocados, using butter or syrup on your waffles, adding some cream cheese or honey, all those toppings and additives that are going to add up and go a long way and help you to prevent that further unintentional weight loss. Next, we're going to talk about protein. And we need protein for growth, to repair body tissue, and to keep our immune systems healthy. Now, again, not only with calories, but with protein, we're going to have increased needs during the course of cancer treatment. Um, Due to surgery, chemo, and or radiation therapy, extra protein is usually needed to heal the tissues and help fight infection. And we also want to maintain your muscle stores throughout treatment. Some sources of protein include chicken, beef, turkey, fish, eggs, dairy, beans and lentils, nuts, nut butters, seeds, and soy foods like tofu or edamame. These go more in depth of the food items that are good sources of protein, what their typical serving sizes, and the amount of protein per each serving. Now, as you can see, the animal sources are going to be the highest in protein, but if you're someone that's vegetarian and you do not eat animal products, this doesn't mean that you need to start eating these products. It just means we got to be a little bit more creative on ways to get your protein intake in because you're more limited. But this is in no way saying that, oh, you're a vegetarian, you need to start eating meat because meat has the most protein. Like I said, we just got to be a little bit more creative if you are a vegetarian. Some tips to add some extra protein into your diet, using plain Greek yogurt instead of sour cream to top, chili or tacos or things like that. Adding cottage cheese to your eggs or pasta dishes. So this might sound like a weird one, but this is very trendy now and it actually does taste pretty good. So you can add cottage cheese to the eggs and beat them up and make them like your scrambled eggs and cook them as you normally would. And with pasta dishes, you can use in like a NutriBullet or just kind of whisk together the cottage cheese and like your tomato sauce to make it kind of a creamier consistency, but that's a good way to add some additional protein. Adding peanut butter powder or whey protein powder to your oatmeal, your yogurt, your smoothies, etc. Adding hummus to sandwiches or wraps. Using chia or flax seeds to toast, oatmeal, yogurt, again, smoothies, etc. And using those oral nutrition supplements that I previously discussed. Those are going to give you a high amount of protein in a small amount. So those can be beneficial when you're going through treatment or just need a little extra boost. So we are going with Chef Jim and Chef Gabby. We'll be going over these 3 recipes today: high protein chocolate mousse, chocolate and peanut butter bark, and broccoli with ginger tahini satay sauce. So I will now stop sharing my screen and let Chef Jim and Gabby take over.
Okay, thanks, Lisa. Okay, well, welcome everybody. Come on, there we go. Now we could see you. Hi, everybody. I'm Chef Jim. This is Gabby. We're going to do the 3 recipes for you. And I think we'll start because we got 3 that we got to do. So first off, we're going to do is we're going to do a tahini satay sauce. Now, when you have tahini or if you have peanut butter, they both give you 8 grams of protein for 2 tablespoon serving, right? So they're both really good. Tahini is it just gives a different spin on it. Traditionally, it's made with peanut butter, but it's really good if you try it with the tahini. It's not as pronounced as peanut butter. Here's a good way to think of it. If someone is having nausea from smells that may bother them, it's easy to smell peanut butter from, a distance, right? But when you have tahini, you don't really smell the tahini. So if smells could be an issue, tahini won't be as pronounced in the smells. So that's something to consider. Or you could do a combination of both. Anyhow, so we're going to begin. So what we have is our mise en place. As you could see, we got everything together. So before you start a recipe, it's a good idea to try to get all the parts and pieces together. We have raisins that were rehydrated. That's our added sugar. So our sugar is coming from raisins, which also have protein. There's fiber, there's antioxidants. There's also something called allulose that goes in there. Um, then we got some tahini, chili paste. We got tamari that is low sodium. Now this tamari, I'm going to let Gabby bring this up closer to you to show them the label, because this one has 50% less sodium. That's what you got to be careful to watch, is some of them, there's a lot of sodium in soy sauce in tamari. That one is a gluten-free with 50% less sodium. We're going to put that in there. We also have balsamic vinegar that is now going in, okay, which will give this tahini satay a really, really great flavor. Okay, so we got our tamari. Now we're going to put in our tahini. See, this is what it looks like. If you want to increase the calories on tahini even more, there's oil that rises to the top of the jar of the tahini. And I'll let Gabby bring that one up to show you as well. Some people, to save on calories, they'll dump some of that oil out. But if you want to increase your calories, just mix that oil in with the tahini. Okay. And then now we're going to add some peanut butter because we want to fortify with even more calories this tahini satay. Okay. And then we're going to add some fresh ginger, which fights inflammation. Okay. This is an optional ingredient. This is just chili. It's a chili paste, sambal oleic. And we're going to, it's optional. You don't have to put it in. It'll give it a little bit of spice, but if you're sensitive to spice, you certainly don't need to do it. That could be totally left out. And then lastly, we got some vegetable broth. And we're just going to put this into the blender. We're just going to blend it real quick. It's that easy to remember. Those raisins are going to give the sweetness, the sugar. And now we just blend it. And that's our sauce. Okay, it goes that fast. So you could see it's pretty loose here, right? All right, now that sauce could get really thick quick when you heat it up. What's going to happen is when you put it in the pan, it's going to lose moisture and it could actually get thick to glaze. So you want it actually on the loose side. It coats the spoon. See how that spoon's coated? It's still pretty thick, but it's still loose enough, right? Now, what are we going to put it with? So for vegetables, we got broccoli that was blanched, but we keep it dry. The reason we keep it dry is because it'll absorb all the goodness in the pan with the tahini. And then I got our pan on. I just put it on. It's on low. I'm going to put a little bit of tahini sauce into the pan, and it's going to get a little thick as it cooks. And you'll see what I'm talking about when that heats up. And then I got some red peppers as well that I blanched off just to show. And then for protein, we're going to use tofu. So for tofu, this is an extra firm because you could see how it's pretty solid and dense in my hand. It comes in a liquid. You want to keep the liquid. But what you wouldn't probably want to do for this one here, I'm going to turn my fire down so you could see here it is in the pan. All right. It's already, look how thick it is. It was loose. You saw in the blender, but just that little bit of heat is starting to thicken this. All right. Now the tofu, the one that you wouldn't want to use would be silken. So this is the silken one that we're going to use in a recipe to follow. If you try to put this in, it'll just mash into the sauce. So we're going to set that aside. Okay. And we're going to use the extra firm one. Now with the extra firm one, basically, you could decide how big or small of a chunk you want, right? So You take it, you can make them big chunks or small. It cuts really easy. Here's our chunks. I'll show you what I mean. I'll put these on a plate and you could see that's what we got, right? Now, to take that out of here, this is an offset spatula. If you get an implement like this, it could help versus having a spatula like this that has less of an angle because now you're trying to dig something out. If you get a spatula that's like this, I mean, look at how that handle's standing up. So you can easily get in here, go in and grab tofu out. So that could help you. And not just for tofu, but for other things as well. Okay, we'll set that over there. Okay, so now, okay, here's the sauce. My flame was on really low, but I just want to show you. Look how thick this got already. Look, so you could see the tracks. Look at the tracks in there. It gets thick really quick because it's reducing. I didn't have a lot in here, just the heat from that pan. So if that happens to you, you could easily thin it out. Just have a little bit more broth. You could put a little bit of broth in the pan because remember, when you go to put the tofu in there and your vegetables in there to heat it up, that sauce will start to reduce down. Okay, now you could, if you wanted to, probably take the broccoli, the peppers, and the tofu and put a little oil in there if you wanted to increase more calories, but then it might be oily and sometimes that could cause nausea, right? So what we got now is we got our tofu, it goes into the pan like so. And then we got our broccoli. We're going to put some broccoli in with the pan, our peppers, or you could use any kind of vegetable that you want. Okay. And then all you're doing is heating this up because these were blanched already. But let's say to save a step and you don't want to take that time to blanch it, which you don't need to do, you could do it all in the same pan by taking like a classic stir fry. Raw broccoli florets in the pan, the raw pepper dice into the pan, add a little bit of vegetable broth or water, and it'll start to steam inside that pan. And then when it gets to the degree of doneness that you're looking for, like a light blanch or just a slight bit of tenderness, or if chewing is an issue and you need to have foods a little softer, just add more liquid and cook it a little longer. And you could do it all into the same pan. For the interest of time, we got it pre-blanch so I could save the minutes of doing it all in one pan. That's why we did that. So now you're just going to heat this up. I wish I had a zoom in camera to see what's in this pan, but I don't because right now it was loose. I loosened it with the broth and it's getting thick again. So I'm going to try to bring this pan up to you so you could see. And you could see already, see how on the edges here it's starting to get thick? That's what'll happen. So it's a time, temperature, degree of doneness issue. Okay, we'll take our plate. I'll bring this here. What I will tell you is the sauce is delicious. It's a great way to follow the tips that Lisa was explaining to you to increase protein and calories. And you could put this on a plate. Another thing you could do is you could make this sauce and you could tell, see how thick it got on the pan? It's not even dripping, right? Yet when you pour it, look what happens. Look how loose this sauce is. It comes out really watery. See, and just by not heating it, see how that part drips, but this part didn't? That's how quickly it'll get thick on you. Okay. Meaning because it's reducing down, but there's only a little bit there. It's a wide surface. So when it reduces, it thickens because moisture is leaving. And when you're done, I'll let Gabby bring that up and you get to see what that one looks like. Okay. Yeah. And another thing, you could take that sauce and just have it separate on the side and have like a crudité of vegetables and use the sauce as a dipping implement. It's delicious that way too. Just the broccoli in itself is good with that. Okay. And it's a great way to get people to enjoy their broccoli. All right. Now we're going to do two desserts. Okay. So the first one is we're going to do a chocolate bark. All right. And to do our chocolate bark, I'll just show you real fast a way to save money when you buy the chocolate. Like anything else, if you buy volume, it could be cheaper. So there's two ways. We only get it in 11-pound brick, but you could also get it from Amazon. That's probably it's 70% cocoa, dark bittersweet. But you could also get it where it's all broken in little nibs, and you could just pour it out of a bag, and you don't have to break it at all. But if you do go to have a bar that you break it, all you got to do is you take that chocolate, you take a knife, and you just shave it. So see what I'm doing? I just shave it this side and it's on my knife like that. See how it just sprinkled on the board here? And all I do is shave it. The reason for shaving it, or you could buy those little nibs, is that we're going to temper it. And here's what I mean by that. So we got the chocolate already in the bowl. You could see how it's shaved. It will temper really quickly this way. Okay, I'm going to put this on. Gabby's going to start stirring the temper. And then what we do is when we go to put this back, we save these leftover shavings and we put them in a 2-cup container. And I'll set this on the side over here, Gabby. And then we save these and we put them in a cup, and then we always have them ready when we need it, right? So anything that's left, we have it. If you need a recipe that calls for chunks, sometimes people take a knife and they'll go like this to break it into chunks. Be careful when you do that because it could crack like an ice cube would be, right? And it could fragment in big and small pieces. For me, I find doing it this way works really well when you're going to temper it. If you wanted chocolate chunks in a cookie or something, then you would just break off one chunk and then fabricate that into smaller ones as you go. Okay, so we're going to set that one there. All right, now we're going to do our chocolate bark. Okay, so to make chocolate bark, okay, we're going to take our pan, right? And then we got a piece of parchment paper right here. Okay, our knife. And so to make regular chocolate bark, you could just take chocolate, melt it, temper it exactly like Gabby's doing right now. And then you could fold in nuts, right? And that would be a chocolate nut bark. But for some people that would have an issue with chewing and biting on the hard nuts, a way to increase protein and calories is simply just by adding the peanut butter. So while Gabby's going to tempering the chocolate, which by the way, when you temper chocolate, you don't want to get it hot more than what your body temperature is, right? You want to keep it under 100 degrees, and the way to do that is simply this. Thanks, Gabby. If there's a couple little chunks left in here that haven't melted, that's good, because what'll happen is this chocolate, if I put it in the palm of my hand, just my body heat will melt that chocolate. It's good chocolate. Just the residual heat in the bowl will melt those leftover chunks because they're small, but at the same time, those chunks will cool that chocolate down, right? So you don't get it too hot, right? Where it won't go past 100 degrees. So you could see now, here's our chocolate. That's what it looks like. Okay, now I'm going to take this pot because I want to keep it warm. I don't want to cook it. So I'm going to bring it over here. We're just going to set that on just so it stays warm a little bit. All right. And while I get the rest of my things together here. Peanut butter. Okay. So for peanut butter, when you get a jar of peanut butter, the oil comes to the top, right? Now, if you're making a P&J sandwich, some people might pour some of that oil off and then stir a little bit in, just enough so they could spread it on bread. But when we're going to swirl it into the bark, Gabby, you want to get oh, you got it there. Perfect. When you go to swirl it into the bark, we're going to do this here, as you could see. And we're going to show you now how to do that. We'll set it there. Thanks, Gabby. So to do that, we want that oil. And so you see how I got a wooden spoon here? this is my preferred way because I think most people might have a wooden spoon at home. It's long, it's got, because it's long, it's easier for you to grip. And I like the ones that got a thinner handle because then they cut through thick better than one with a thick handle to slice through, right? And just by going like this and mixing it, I can mix that oil and see how that is starting to just dribble down a little bit. Let me come up closer. This is what you're looking for. Okay. So if you take the peanut butter, see how that's drizzling down? Just it's not pouring down, but it's loose enough, right? That's the consistency. If it just hung there, we're not going to be able to swirl it through. It'll just lump up. But when it does this, I can actually make a nice drizzle, slice the knife through it, and that's how we get the swirls in there. Okay. And so we'll show you that now. Okay. So see what we did? We put the chocolate back on here. It's not on the stove, but just that residual heat was enough to keep it, from cooling down too much. Actually, we'll set this here because Gabby's got one more to do yet. I put it on the fire, Gabby. Okay, now the other thing is before I even put it there, I take a towel and I like to wipe the water off the bottom of the bowl because water could cause chocolate to seize up. So I want it dry. So now all I'm going to do is let me get my spoon out of here so I'm all ready to go. I'm just going to set this down there. Okay. Got a spoon and my knife and we're ready. Okay. So now we're going to take this chocolate. As you can see, I got a baking pan and it's got parchment paper on top, right? Or you could use wax paper. And the chocolate now is just going to go onto this wax paper, just like so. All right. Okay. And you want to try to keep it contained. I'm just doing a small amount here. Okay. So now, if according to the recipe that you'll have, if it calls for, a half a cup of peanut butter, well, you could follow it exactly, or you could just, eyeball it. We just did it for purposes of doing a nutritional analysis. Okay. So now we take our spatula. And so here's the chocolate. Just look at, I could even just, it's warm enough that you could see how it's, sliding on the paper. I'm just going to take it, make myself a nice little rectangle here like so. And there's my chocolate. I'm just going to keep it like that. You can make this as thick or as thin as you want, right? Now to do the peanut butter, okay, we're going to take a spoon. I got my peanut butter and I have my knife and basically it's just like this. I'm going to take it and I'm starting on one end, just like so. And you could see because it's loose enough, you could see what I'm doing. I'm just making a line, a strip across the chocolate. Now, depending how much protein and calories you want to add, that's subjective up to you, right? If you really want to add more, instead of doing 3 strips, do 4, right? If you want less, only do 2, okay? But it's that easy to do. So see what I'm doing? I just got those strips. A key part of doing this is the consistency of this peanut butter. If you have it too loose, you'll have challenges when you go to break it because it's going to be too loose. If you do it too thick, it's just going to lump up and you're not going to be able to swirl. Okay, so here's what we got. See that? We got our 3 strips. It's that simple. Okay, so now we're going to just slice through it. So we just go, it's almost like making a half of a figure 8. We go in just like so, swirl through the knife, and there you go. We're going to set that down there. And that's what we got. That's our chocolate. And now I'm going to switch with Gabby. Thanks, Gabby. Okay. So now when it's done, you could put that into the refrigerator like so. Okay. Then after the refrigerator, I like to freeze it. And this is what you get, just like that, chocolate bar. Now we take that, and when it's frozen, you just break it. Now you get to break it into whatever size piece you want to break it, like so, or break it in half. That's your pieces. And then you could take it and you put it on a plate. I'll let Gabby bring that and show it to everybody. Okay. And that is our chocolate bar. So now you can modify that. Let's say you had some dried fruits that you wanted to put in there, you could do. You could certainly use any type of nut that you wanted to do. People sprinkle coconut and things in there. So it's subjective to your want, but at least you got the idea how to do it. And when you're doing it yourself, you could actually save yourself a lot of money, okay, in the process. Okay, now we're going to do one more. All right, this one here, we're going to make a mousse, okay? So, and this is what we're going to do. So this is a cashew tofu mousse that is absolutely delicious. And we just got cashew, unsweetened almond milk, silken tofu. Okay, we got vanilla, we got cocoa powder, and the only added sugar is in the form of a pure maple syrup. If you want to even add peanut butter to the top, you could do it to that, and then put that in some stemware, and then you'll have a nice mousse, or put it in little cups if you wanted to, and then you could have small increments to pass out. On the almond milk, what I'll show you is we got two kinds here, okay? And when we buy almond milk, I try to get the almond milk that doesn't have a lot of extra stuff in it. So here's two examples of almond milk that only has three ingredients: almonds, salt, right, and water. And both of them are like that: water, almonds, and salt. And you'd be surprised when you look at the nutritional analysis of this one versus like almond breeze or silk. It has more protein, more calories because it's got more almonds for the same serving size. Okay, so, and on this one here, Califia, you got to make sure that when you get it, you get the organic, because other ones got added sugars to it, where this one doesn't. I always get the unsweetened kind. All right, so now we're going to start melting that other chocolate, Gabby. Yep, you could go ahead and do that. And then we'll do the same thing. We could keep it warm on here once it's melted. Right. Okay. So now we got our blender again. Okay. We took cashews that were soaked overnight. All right. And that goes into the blender. Then we got our unsweetened almond milk. Okay. With the cashews. We got our vanilla. And then we got our maple syrup. Okay. Which is subjective as well. Okay. And then now we're going to put a good dose of protein in with our silken tofu. That was 4 ounces of tofu. You guys got the recipe. I got cocoa powder to put in yet and chocolate, but I want to mix this first before I put in the cocoa powder, because the cocoa powder is going to thicken it, right? So we're going to do it like this. So now it's nice and loose. I blend it. You want to blend it till you see it's like shiny and silky. That means if it's gritty, it's not blended well. Okay, so now it's pretty smooth. It's pretty loose. I'm going to show you what I mean by that. I actually got it going on slightly a little bit still. All right. So you could see it's coats the spoon. It's really nice. The cashews are blended well. Everything looks pretty good in here. Okay, it's still going a little bit. I'm going to ramp it up a little bit more, and then I'm going to add the cocoa powder, and it's going to blend in. As soon as I add that cocoa powder, this is going to get thickened a little bit. And then I'll show you what the challenges are and what you could do at home. So how are we looking on the chocolate, Gabby? Okay, so while Gabby's doing it, when we do this chocolate, we're going to want this one warm because it's going to cool down quickly when we put it in here. Now, here's what'll happen. If you have a support person or someone with you, that one person could be holding this, turning it on where you see a vortex going, and then the other person pours the chocolate through the top. It works great. If you're by yourself doing it, I'll show you how, because I did those by myself yesterday. So you'll see. Okay. So now I got it on slow. All right. I got my cocoa powder. It's going right on the top. I just dumped it in. Now I'm going to turn it on fast and high. Okay. Now it's mixing. It's blending. We're looking okay. Okay. Now, while that's doing, it's almost there. Mixing pretty good. Going around. Now we're looking great. I got a vortex. Now what's going to happen is now it's going to stop. Okay, I'm putting this on slow, so I'm going to try to show you by myself without Gabby, because this is what you'd have to do at home. So if you don't have a blender that doesn't have a variable speed, you don't want to do this. Then what I would advise is we take it out of the blender, put it into a bowl, pour your chocolate into a bowl, and whisk it. That would be the best and easiest way to do for you to mix the chocolate. Okay. You don't want to take it and put it in here while this thing is going if you can't turn it down really low. Right now, I could let go of this because that blade is going really low. Now I take the chocolate, thanks Gabby, and I'm just putting the chocolate into the blender like so. That easy to do. Okay, I could hear the blade already. It's going really slow, almost stopping because of the thickness of the chocolate. I put the top back on, right? And you could actually turn it off if you want to even be safer. Now I blend it and we're beautiful. Okay, and that's what we got. We're done. So if you didn't have a variable speed, I would take your blender, turn it all the way off, put your chocolate in and blend it, or you could take that out, put it into a bowl, pour your chocolate into a bowl, take your spatula and whisk and fold in the chocolate into the bowl. So you got those two options. But when you're done, you'll see, look how beautiful this comes out. I mean, it's really thick. I'll show you on a spoon. And right now it's warm, and you could see how thick it is while it's warm. And that'll be enough right there. I'll put some on a spoon. I'll bring this up to you so you could see, but you'll get the idea. There it is. This is warm. That's what it looks like warm, right? And if you wanted to, now would be the time. If you wanted to add peanut butter to it, you could take peanut butter. Now would be the time to do it. And then if you wanted to, you could even just like you're making your own Reese cup here, right? You could put peanut butter on top, like so, swirl the peanut butter in, or just let it sit if you want, like that. You could do that. All right. And when it's cold, though, right, you'll see how thick this is when it gets cold, right? So when it's cold, it's actually like a chocolate truffle ganache. Look how that is, right? So these are three different ways, three different recipes on how to add more protein and calories We did the chocolate because sometimes people just like a dessert. And the only if you use 70% cocoa or 80% cocoa, dark, bitter, sweet, there's some health benefits to doing that. The added calories and protein are actually were a healthy source by using the peanut butter and tahini into the first one. If chewing is an issue, the peanut butter is better than nuts. You could even put whole nuts on top. And come on, Gabby. And so happy to take any questions if anybody has them, or you could put them in the chat later. And Lisa, anything you want to add or?
Oh, nothing that I want to add. Great job with the recipes. We can turn it over to Dr. Umeda if you guys are all done.
Yep, we're all done. Okay.
Perfect. Sounds good. Thanks,
Thank you.
guys.
Yep.
Great, thank you, Jim and Gabby. So, nice to meet you, everyone. I am Dr. Umeda from the Wellness Department. Wanted to share some, kind of introduce our specific program, which is called Integrative Oncology. You might have heard of something like integrative medicine or holistic medicine or something like a natural thing. So, sometimes you may get cause that confusion what it is. So I wanted to share some information about that. So I just changed the screen to share with you. So on the left side, you can see what is integrated medicine for the cancer patient. So this is the patient-centered, evidence-informed field of the comprehensive cancer care that uses lifestyle modification, mind-body prosthesis, and also natural products or natural therapy alongside the conventional cancer treatment. So now lots of big cancer centers such as MD Anderson in Houston, Texas, Memorial Sloan Kettering in New York, Dana-Farber in Boston, Cancer Treatment Center of America, and also other cancer centers have the specific program for integrated medicine or integrated medicine for the cancer patient, which is also called integrative oncology. So what we do here in this program? Again, this is something to additional support physically and mentally. If you are receiving any, let's say, chemotherapy, immunotherapy, hormone therapy, surgery, radiation therapy, everything, you just continue that. And this is an add-on things to support you. So our program, which have the nutritional counseling, if you have any specific question about the diet or nutrition during the treatment or even after the treatment, which is the cancer survivorship, especially some people have the interest for the weight management. And also even from scientific perspective, there are lots of data, the weight management. I mean, people who are overweight has a little bit of higher risk of some recurrence. It depends on the stage of the cancer, but generally speaking, the being obesity or overweight, it may increase the risk of the cancer, or it may recurrence in the or metastasis in the future. So how to prevent it, how to minimize the risk? We have a specific program for the weight management, especially again using the lifestyle modification, mind-body practices. We believe the mind, brain, mental, body, they are all connected to each other. So work on your whole body system, which is the whole person approach, or we also call it holistic approach. In order to do that, we have a yoga teacher and also meditation, mind-body practice, exercise program, and also we have a hands-on therapy people like chiropractic, massage therapists, and as acupuncturists. We have 9 acupuncturists in our department, and everyone has a well experience for the cancer patients. And also, if you have a specific question about the vitamins or supplements, this is very, we have to be very careful because if you want to use some natural medications, there's a possibility, very like a kind of risk that, let's say, certain chemotherapy drugs and the natural medicine may interact. So we need to avoid that. So sorting out, this is good to do, good to take, this is not good to take. Yes, that's one of my role as a doctor. So everyone has a different questions, but this is one of the things. So like I said, if you see, as I briefly mentioned, there's a growing evidence, like a scientific data or research data for the, let's say, pain management. Acupuncture has been proven to be effective. Massage therapy, meditation, even yes, mind-body connection work, like meditation can work. Let's say fatigue, yes, exercise, yoga, and acupuncture could be beneficial. If you go down that, like a neuropathy, then a numbness, tingling in your hands or feet. Yes, acupuncture, massage therapy, maybe reflexology can be helpful, like that. So for the each category, for the each symptoms, bothering symptom, there are lots of data. So based on the research data, we'll provide, how about this, like that. So it's more like a personalized advice or approach. So this is really just a brief introduction of the integrative oncology program, which is really beautiful collaboration with our wellness department and the Taos Cancer Center palliative medicine department. Yes. So if you have any questions, if you want to make an appointment, this is our contact. The phone number is 216-448-4325. My name is Naoki Umeda, one of the staff physicians here at the Wellness Department. Our main office is in the Willoughby Hills, but also I do the outpatient clinic at main campus, including the Tausig Cancer Institute and also Glickman Building, which is called Q Building, once a week, which is every Monday. And also I do the virtual visit as well. Yeah, so just and I wanted to have some brief introductions. And if you have any question now, yes, happy to answer any questions, or you can put in a chat box. Thank you.
Thanks, Dr. Umeda.
Yes.
Yeah, if you guys have
So,
any questions, now's the time to ask any of us. And I will go ahead and share my screen. If anyone has any questions for Chef Jim or Chef Gabby, Dr. Umeda, or myself, feel free to come off mute or send a message in the chat. So someone asked, does insurance typically cover that service?
yes, to see the doctors like myself, it is covered by most of the insurance. Yes, it's considered a general usual doctor's visit, so it should be covered by the insurance. And I can see the next question. Where can we find the future reference? Oh, this is about the whole recordings, I guess.
Yeah, where can we find the recording for this for future reference? Bria, do you know where this will be located?
We have a YouTube playlist of all of our past recordings. I will send a follow-up email with information. So just look out for email with me by the end of day tomorrow, and you'll have all of it.
Awesome. We do have another question. For the neuropathy, you show acupuncture, and how long is the treatment for?
So typically the acupuncture is done once a week or every 2 weeks, and usually the acupuncturist wants to do the treatment for 6 sessions first. So initial session treatment will be 1 month to 2 months to see how effective it is. After that, it will be really decided or recommended by the acupuncturist, depending on its effectiveness and also your overall condition, and also you're still receiving the chemotherapy or not. So like after that, they may recommend some maintenance treatment such as every 3 weeks or every 4 weeks or every 2 months. So really it depends on your conditions.
Perfect. And the next question, it looks like, I can answer this one. My appetite is strong. I don't need more calories. I need less. Where can I get info on this? So any of us dietitians can also discuss, if you are gaining weight rapidly during treatment or your status post completion of treatment and enter the survivorship, stage, and you need help losing weight that you might have gained from treatment, we can definitely help in that regard as well. And we can provide you with the scheduling number for that. It is important to keep in mind that us dietitians, we are free of charge if you're currently receiving treatment and up to a year after treatment has been completed. If you are no longer on treatment, we would have to bill, just to keep that in mind. Someone else asked for the chefs, then where will we get the recipes?
Lisa, I'd just add to that as well for to lose weight or have less calories is that in our culinary medicine program, we have a lot of culinary medicine techniques that you could see in our toolkit online that was posted that Bree could direct you to the cancer site. And there's also 113 episodes of In the Kitchen with Chef Jim and Dr. Mike, which is Dr. Roizen, where we show people how they could sweeten without adding sugar, how they can make things moist without adding fat, how they can make things savory while reducing sodium, and how to prepare foods that are less in calories but are nutritionally dense. And so there's a lot of techniques and tips and the culinary medicine toolkit on how to do that as well. And Bree would talk about where to access the recipes, I think.
So then what is the phone number to reach the dietitians? I will include our scheduling number. You can reach out to our schedulers to schedule an appointment. I will include that here in the chat. There any additional questions or comments for any of us?
Yeah, I'll just add, Lisa and everybody, is that in all these sessions, we look for when there's a survey that comes out, if there's anything open-ended, feel free to put in any comments on what you would like to see in future sessions. Any information on how we could help you the most to navigate meal preparation challenges, and any ideas that you could help give us on how we could better serve you and your needs.
Any other questions? All right, I'm going to take that as a no. So, thank you all for joining us today. And if you need anything, let us know.
Thank you, everybody. It was a privilege to do this for you.